In this video, we're going to talk about some alternatives to the more traditional psychotherapy and medication approaches to OCD treatment. The big picture thing to realize is that there are some supplements out there that might help for some people, though in general the evidence is not great. And that if people have tried medications and had limited success, there are some additional procedures we could consider that have helped for many. Are there any supplements for OCD that have good evidence behind them? There have been studies looking at a variety of supplements in order to help with OCD, things that you can find either over the counter or in a herbal shop of some sort. One, for example, is inositol, which in high doses has been tested for OCD and in some cases has been helpful, though in most cases it has not shown a significant benefit, certainly not nearly as much as the SSRIs or other approved medications for OCD. N-acetylcysteine, which is another over-the-counter, is used perhaps more commonly for OCD, though has better evidence for people who struggle with hair pulling and skin picking, and still isn't as effective for any of those as more traditional medications. Omega-3 fatty acids can be good for brain health in general, though studies have not shown a robust improvement for OCD. L-theanine, found in green tea, has also been used for some people to help with the calming properties, but also not shown to really be beneficial for OCD, though not really studied that well either. What is the evidence for alternative treatments like TMS, ketamine, and DBS? For people who have limited benefit or at some point kind of hit a wall in treatment with more traditional therapies like ERP, SSRIs, there are other options in addition to trying augmenting medications like Abilify or Namenda. There's also procedures like transcranial magnetic stimulation or deep brain stimulation. These should be discussed with your individual provider and are typically only turned to after many other failed trials and will usually only be covered by insurance in those cases too. Transcranial magnetic stimulation uses magnets, is generally considered pretty safe and also effective for some people with OCD, whereas deep brain stimulation is more invasive. It's actually a surgical procedure, but has been remarkable for certain patients who have really struggled with severe symptoms. Ketamine needs to be studied more, but is promising and may eventually include incorporation into the actual psychotherapy itself. Some people receive some, but only partial benefit to first-line medications like SSRIs, or they try a medication like clomipramine and also only get partial benefit. In those cases, we will often use what's called an adjunct medication or an added medication that essentially boosts the effectiveness of the first medication on treatment, though they don't directly work with each other. These medications can include Namenda, also known as memantine, which was originally discovered for Alzheimer's, but actually is a very tolerable side effect profile and works pretty well as an adjunct for people with OCD. Other times we'll use Abilify or Risperdal, originally discovered as antipsychotics, but these medications are also used for people with depression and other disorders, and it turns out for OCD they can be helpful as well. Which is the right choice will depend on your specific situation, as well as a consideration for the potential side effects, and so that'll be a discussion you'll want to have with your healthcare provider.